Good day, Mom. I am Justin Marjorie Kate Andres, a BSNE student from MCNP. So for today, I will be performing the assessing of the thorax and lung. So first is identify the patient. So for verification lang po, Ma'am, may I know your name and your birth date?
I'm Evangelina Matindol po, February 2002.
Okay, thank you, Ma'am. And then the next is explain the purpose of the respiratory examination and then answer any question. So, the respiratory examination is to assess the palpate the bones, the tenderness, and then the spine. And then the next is perform hand hygiene. And then the next is help the patient undress if needed and provide a patient gown and assist a patient to a sitting position and expose the posterior thorax. And then the next is palpate, inspect the posterior thorax, examine the skin, the bones, the muscle of the spine, and then the shoulder blades, and then the back as well as the symmetry. And then the next is assess the anteroposterior and the lateral diameter of the thorax. And then the next is over the spine and the posterior thorax, using the palmar of the surface of the hand and the patient side of the spine. And then the next is instruct the patient to take a breath slowly. Okay, Mom, can you breathe slowly? And then assess the tractor practice using the walls of the hand by and then ask the patient to say the 99. Okay, Mom, can you say 99? Okay, thank you, Mom. And then the next is to assess the thoracic expansion by standing behind the patient. Place the both hand in the side of the patient of the spine. And then instruct the patient to take a breath slowly. And then note the movement. And then the next is percuss over the posterior thorax and the lungs, feels for the tone using a zigzag pattern. And then the next is forecast the diaphragmatic expulsion on each side of the posterior thorax. And then the next is auscultate the lungs across and down the posterior thorax. And then instruct the patient to breathe briefly through the mouth. Okay, the next is examine the anterior thorax and then rearrange the sitting of the patient and then rearrange the gown. And then the next is the examine the anterior thorax with the skin, the bones, and the muscle mass. And then the next is palpate the anterior thorax and then the tactile remittance. Okay, the next is percuss the anterior thorax. And then the next is auscultate the anterior thorax. And then instruct the patient to take a breath slowly through the mouth. Okay, the next is to inspect the breast and the axilla with the patient head side. With the patient side. And then with the patient hips. With the patient hand hips. And then over the head. Raise the head over the head. And then the next is palpate the axilla with the patient arms resting beside. And then the next is place the pillow and then rearrange the gown of the patient and then assist the patient to a comfortable position and then perform hand hygiene and remove the patient gown or assist the patient gown to change the gown.